everyone, it's Jen. I am going to quickly cover straight leg raises in supine and then bent knee extension and flexion in supine. So something to keep in mind when you're teaching this, you're teaching the person how to isolate movement at the hip and at the knee. Or you're trying to isolate movement at your hip and knee yourself, depending on why you're here. So what you want to think about and what you want to make sure is that your pelvis stays pretty stable. There's something that I've noticed people do when they don't have a lot of motor control in this area, and that is they'll hike the hip of the leg that's extending. So the leg will extend out and the hip will hike up. This takes away from the movement being purely a hip movement, right? So we're trying to get rid of that. So go ahead and lie down on your back. Reach your right leg out. Feel the weight of your pelvis against the floor. Maybe take an exhale. It'll help your ribs come down and soften. Feel the connection of your mid-back against the floor. Get strong through your right leg. So your right knee's not bent. You're going to lift the leg up, lower the leg down. And just stay with this pattern. You want to go slow enough that you're controlling the movement. And there will be a natural movement posteriorly at the pelvis on the right side. Right? That's just kind of naturally what happens. It's not huge, but there is a little bit of movement that way. But there is not any movement in this side-to-side leg. That all stays really stable. So if I took my hands here, I wouldn't feel any lifting up of this right hip. And go ahead and lower that down, switch sides, left leg extends. The sides do tend to be different. Same thing, exhale, let the ribs come down. Strong through your left leg. Like this side for me is a little more clunky. And I have a hard time keeping this leg straight. So I'm just teaching, again, hip flexion versus knee flexion. Take one more. From here, pick the right foot up, take your hands behind your right leg. Same thing, pelvis didn't hike at all, it stayed stable. Exhale, ribs come down. I'm going to dorsiflex the foot right away. You don't need to, you can keep the toes pointed. I apologize for the holes in my socks. As you exhale, straighten the right leg. Inhale, bend the right leg. And I want you to notice that as I do this, I am not moving my upper leg at all. So again, I'm just isolating movement at the knee joint. And go ahead and switch sides. I do anywhere from 6 to 10 of these. Dorsiflex the foot. Again, I'm dorsiflexing the foot immediately because I'm teaching isolation. There are other ways this can be taught that involve pointing the foot on the way down and then pulling the toes back on the way up. But for today's tutorial, we're just focusing on this knee movement. Take one more. And again, if you're paying any attention, you'll notice the side is a little less smooth for me. Go ahead and notice. And come on up. So those are, like I said, super basic. You've probably seen them before. There's nothing fancy to them, but they are effective. They're a great way to teach differentiation of the joints, and then they're also a great way to just get a little bit of blood flow going to the area. All right, thank you. If you have any questions, find me at www.bewellpt.com. Have a great day.